Hi, everyone. Thanks so much for coming. Just waiting another minute here to make sure that we have everyone trickling in. Okay. All right. So, welcome everyone to the Therapists in Tech Fireside Chat on concrete steps to transition into tech. My name is Terrence Penn, the Therapists in Tech grads leader and co-organizer of this event. Here with me today as co-host and co-organizer is Sharon Kim, Therapist in Tech Operations Assistant. I look forward to introducing our distinguished speakers today shortly. But first, I want to go over some few housekeeping items. First, today's program will be recorded. Anyone who speaks during the fireside chat, for example, to verbally ask a question or make a comment, is agreeing to be recorded and is granting permission for the recording to be posted on our website at a later date. Today's discussion will be an unstructured panel involving conversation between our speakers and attendees. Fireside chats are meant to replicate an intimate group discussion, and at any point, you may feel free to unmute yourself and say your questions and comments aloud. You may also use the chat function to share your questions and comments as well. And also please ask for everyone to be respectful of each other's comments, questions, and perspectives. With that said, it's my pleasure to introduce our speakers today. Today we have Dr. Mercedes Oromendia, Chief Clinical Officer at Manatee, and Dr. Tim Campellone, Vice President of Clinical Science at Click Therapeutics, Inc. Today we're going to start by having each speaker briefly share their training background, their current job roles, and how they transitioned into tech. And I guess I'll have Mercedes to start us off.
Sure, thank you. Hi, everyone. I'm Mercedes. Let's see, I'm a psychologist. So I went to school at UC Santa Barbara, and I did the combined program. I have a few left in clinical counseling and school psych. So my emphasis in counseling and clinical. And let's see, I'm based in LA. I am licensed in California, Colorado, and now New Jersey coming up. That's part of, I feel like, health tech, just expanding and getting licensed in quite a few states. A little bit about me. Let's see, my training, so UC Santa Barbara, then a postdoc at UCLA. My area of expertise has always been children, families, and parenting, specifically looking at child abuse, trauma, and working with foster youth. And then, so that was my specialization for years in community mental health. So working with low-income families and families that were really struggling, and also working with diverse families. I'm originally from Argentina, hence my name. So providing services to families in Spanish, and I lived in Brazil for a while too, so Portuguese is something that's important to me, and also thinking about cultural variables and family variables. So working within the foster care system for a long time, really acknowledging that families can look very diverse, very, very different, making sure we're serving a wide range of families. And Terrence, you asked a little bit about transitioning to health tech.
Yes.
So I was completing my postdoc at UCLA, and I always knew full-time clinical was not for me. I love clinical work, but love it part-time, and was getting a little frustrated with just some of the inefficiencies I was coming across in community mental health. And in many different roles, I kept finding myself just having different ideas and wanting to change things, and really feeling like we were kind of hitting barriers, usually systemic. Sometimes they were from the organization, or just real barriers, right? Other needs were not being met, and a lot of therapist burnout and families and stigma, and just a lot of things I wanted to be able to change. I had no idea about health tech at all, and started kind of looking around, trying to decide what I wanted to do next. And one of my good friends was working in health tech and suggested it, and I started just getting to know people. and consulted for a few startups. Really ended up being a clinical advisor for Manatee, and was just their clinical advisor, which was really fun, providing the clinical expertise to the team. And then I was, right place, right time, had already been part of the team as a clinical advisor, and they shifted their strategy and brought their care in-house. And so that was in a year ago, January of this year. And so I became their chief clinical officer. So it was a little bit right place, right time, willing to stretch a lot, because it's a lot of new things that I'm doing and learning, very humbling every single day, but really fun too. And so that's a little bit about the transition.
All right. Well, I'm happy to also talk a little bit about my journey here. So I'm a clinical scientist by training. So also in the UC system, but a little bit north of Santa Barbara. Went to grad school at UC Berkeley. Then moved for a year to Seattle for internship at the Puget Sound VA before getting lured back to the Bay Area for postdoc at the San Francisco VA. And I guess what I'll, maybe launch into now how I got here. So at the time when I was doing my postdoc, I was working on a career development award, and it's kind of the VA's equivalent of the K award for folks that aren't familiar. I really was kind of faced with, what I wanted to do. I had got my first digital experience in graduate school, collaborating on the development of a digital intervention for young people with schizophrenia. My training background, clinical and research, is in treatment development for serious mental illness, primarily schizophrenia. And so I was passionate about digital, and I knew I wanted a career that had that footprint in it. And increasingly, as I was working on my CDA application, it became apparent that what I was ultimately going to be able to propose and potentially get funded was kind of like the equivalent of a web-based kind of social skills training, which would be valuable. But I started to kind of do the math in my head. Okay, it'll take probably a couple of submissions to get this funded if I get it funded, plus 5 years of the grant, plus another year and a half to get this kind of published. So in 7.5 years from now, will this be something where an N of 30 is going to be meaningful? And like, will this be contributing to kind of clinical science as a whole? And I started to really kind of check my own values of, like, part of why I got into this field, or why I wanted to help people with schizophrenia, is the unmet need, the ability to not kind of incrementally advance what I think is a need, long overdue needed solutions, but really push the envelope and really try to make up for the lack of progress that we've had. And so made the decision at that point to kind of forego the CDA path. And at the time, a company that some of you may have heard of, since they just got listed on the NASDAQ this week, Click Therapeutics, just happened to be looking for someone to help build a digital therapeutic for schizophrenia. So I think similarly, the right place, right time mentality of, okay, well, this seems interesting and seems kind of like what I want to be doing with my life. So made the leap, and that was back in 2018. Spent about 3 years there, and it was just incredible learning for what does it mean to be a clinical psychologist, a clinical scientist working with a product development team. How do you build a product? What are these roles that I had to kind of learn on the fly, because I didn't know what a product manager was, or that there were people whose whole job it was to do IRB submission and run studies, the beautiful clinical operations folks, which I now come to love. Ultimately made the decision to leave Pear and join Click mid-pandemic. And that was largely because I wanted to do beyond just building digital therapeutics and treatments. I wanted to really get into how do we explore all that digital is capable of doing. So how do we embrace the fact that things like CBT, which were developed under the constraints of face-to-face treatment, are an important foundation for how we can enable behavior change. But there's this whole unique digital modality that I don't think we've fully explored. How do we embrace digital-first ways of doing treatment? And so I had the privilege of joining Click to lead up our science team and to really help build our research and development process. Our internal team focused on kind of marrying traditional product development with kind of innovation from a clinical science standpoint, really pushing what digital can do and how that can be leveraged to provide care to people. And recently I had the good fortune of being promoted, and now I'm kind of expanding our kind of R&D footprint. So as we were fortunate enough to raise a funding round, how do we continue to do this and really push into new areas? So more than happy to talk to folks after this that are interested in looking for opportunities. Feel free to DM me on the Slack channel if you have any questions. But really excited to be here. I can't say enough about therapists in tech. It's so valuable to have this resource. When I was making my decision, nothing like this existed. So I'm more than happy to be here and to talk to all of you and answer any questions and be as helpful as I can.
Thank you, Tim and Mercedes. And now I'd like to open it up to the group. In terms of why we're here today, about discussing how to actually break into tech, because as many of us realize, there's not really a book out yet in terms of how mental health professionals might be able to get into a tech field, or what's even out there, or even the first step of just figuring out, as both of you had talked about, figuring out your values and maybe recognizing some of the limits of your field. But in any case, I'd like to just open it up here. Let's see, Patrina had mentioned a comment in the chat. Interesting comment, Tim, about the amount of time for research and how that explains why so few tech companies have clinical research.
Yeah, I will say it's a trend that I'm hoping continues as more companies. I think the first wave of at least digital therapeutics companies was more focused on just treatment development, but increasingly I am seeing more companies embrace the value of kind of pairing the traditional clinical product development pathway with more research approaches. And frankly, I think the best models I've seen of this are partnerships where you span industry and academia to really not just do it all alone. I mean, there's tons of great research being done in academic medical centers and institutions. And I think that's a model that increasingly I see a lot of people exploring. How do you leverage the best ideas in an academic environment with the ability to execute in the resources that companies have and can bring to bear.
Yes, and yeah, you can post any questions or unmute yourself and just talk aloud. Again, this is more meant to be like a intimate group discussion.
And I also want to clarify, there's really no dumb or questions that are too basic. I Googled all the randomest things, called different friends. It's like Tim was saying, this network is really valuable. And so just ask away anything that you're wondering about or not sure.
I have a quick question. So just to give some background, I'm a current second-year Ph.D. student, and I entered Therapists in Tech a couple months ago. And I really just am wondering if there's any advice you have for navigating like what the different career path / opportunities are out there. Like I just don't know like if I would want to be like on the product side or research side or clinical side. Like I just don't even know how to interpret the job descriptions as for like what the options are in terms of like paths, if that makes sense.
Yeah, I mean, it's a great question, and it is something that it's hard unless you have kind of seen the inside of a company to know kind of what these different paths are. I mean, two thoughts come to mind. I think one is, understanding like what are the things that excite you most about what you currently do, because I'll say one of the things that will happen inevitably is, as in academic settings, you wear a lot of hats and you're kind of doing a lot of things, and that tends to focus a little bit more, where you'll spend more of your time doing a smaller number of things as you transition and as you specify kind of what a role is. Obviously, as soon as you join a startup, lots of new opportunities present themselves, but at least the roles you're looking for will look for a set of qualifications. And the other is, if it's something that you're able to do, is exploring more hands-on like internship opportunities, which I know are increasingly popular in because I think there's no substitute for the experience of kind of absorbing and just hearing how people talk. Like I still keep a little notebook next to my laptop where I kind of will jot down things that people will say. I've gotten much better at just calling it out in the moment and asking people like what these things are, whether it's acronyms or kind of shorthand, but I still, similar to Mercedes, will Google things because there's still a lot I don't know as I talk to commercial colleagues who have been that know the ins and outs of how to sell things. I've never sold anything as a psychologist, so there's still a lot that I get to learn each day. But yeah, if you have an ability to do an internship, I think there's no substitute for that.
Yeah, and what I would add to that are informational interviews. People would love to talk to you about what they do and how they got there, what their day-to-day looks like, what they don't like, what they were surprised about. Because even the same job title may look very different in different kind of the stages of the startup really matter too. Because it'll be all hands on deck, or it's a little bit more specify what you're working on. And so really getting to understand that could be helpful too.
I see a question in the chat. I'm going in order. Do mental health companies look for specific experience when it comes to non-clinical roles?
I would say yes. I mean, it depends what role it is, but if you're managing people, have you managed people before? Maybe it's supervision. Have you created a program? Have you done research? Have you applied for an IRB? Really depends what your role would be that's non-clinical, and how do those skills transfer. There's a lot of skills that we learn in grad school that do transfer over. I just had to learn the lingo to change it. Talk about the outcomes, talk about what my effect was, instead of highlighting other things. So turning that CV into a resume took a little while. We're really working on, we have a lot of skills and abilities that transfer. We just need to kind of know what those are.
Yeah, I think that was a great answer. The only thing I would add there is, I at least when I'm looking at evaluating people who are applying and join our team, it's really like I have no expectation that anyone has previous industry experience. So a lot of what I'm looking for is like what are some of the skills that I've seen translate well, like like tolerating uncertainty is a big one because startups change rapidly and it can be very abrupt. And for people that are used to the kind of long-term, like this is the 10-year vision for my research kind of program, to have things change, week to week, month to month, not, on different scales, and to have kind of deadlines that you're working against. So I think there's certain skills and intangibles that I tend to look at that are more important than particular kinds of experience that you might have, because I think those have been, at least in my experience, more predictive of who is able to have success and who is able to kind of make that transition, particularly right out of an academic environment. If this is your first or kind of industry foray.
Someone
ask a question.
Oh, please go ahead.
Yeah, so I'm one of those folks that has successfully made the transition over many years, and I have my own consulting business now. And something that I'm focused on in the year ahead is supporting other folks in helping professions make the switch. And I'm going to ask you a real therapist question right now, which is, what are some of the mindset challenges you navigated if you left, directly serving clients in either private practice or an agency setting like some of you do, and then going into the research or product side? I find that in my work with folks, the hard skills of learning how to interface with these different departments can be taught, but there's something really special about your identity as a helper. And when you shift from doing that in a really direct way, sometimes it can be some challenges or friction. And one, I just wanted to call that out and normalize that for anybody that might be feeling that. And two, ask you all if that's something you face and how you navigated it.
Yeah, I'm actually in the middle. So part of it is because of supply and demand, I'm seeing a caseload, and that was unexpected through Manatee. So that's really hard because it is a different mindset. So trying to do the higher level strategy, hiring, building that, and then also clients, I'm feeling that tension of it does require something different. So yes, I think you're absolutely right. And part of the challenge that I've faced too is that with clients, you get more of that immediate feedback. It might not be in measures necessarily in that moment, but you do get that feedback and you start seeing that progress. And so working with product, you don't know, right? So like when I'm collaborating with product and we have some idea, it could take a while for us to really know, is it having the impact that we're hoping it will have? And so really being patient has been patient and working quickly at the same time. It's both this sense of urgency and waiting to see if it actually pans out the way we were hoping it would, has been a new experience.
Thank you.
Someone in the chat had asked, do you see that a PhD is needed to transition from academia to, or working as a mental health professional to industry?
I would say, I think this is probably going to be a recurring theme, but it depends on really what the role is and what other experience. I mean, I would say for a lot of the roles on my team, in fact, I think everybody has a PhD, but it's not necessarily a hard requirement. Like if someone had another terminal degree and had additional experience, I think that would be on the same level as someone with less experience but more training. So I think it really depends on the role and ultimately what additional qualifications or experience you have that is relevant for the role, and how, at least how I would think about it as a hiring manager, weighing the two or the two different paths.
Yeah, to me, it really depends on what role you're going for. If it's content creation, if there's things that really it may not make a difference. For others, you may need that. It really depends.
So I have a question. So in line with what we're talking about in terms of kind of experience and non-clinical, would you advise kind of for somebody trying to make that transition to, in a way, I guess, kind of apply, shoot their shot, or should they go kind of the advisor route first, try to find some consulting roles for a little bit before they kind of make the huge jump? Especially with both of your experiences, it sounds like it was right place, right time. What would be kind of how you would advise people to make that jump?
I mean, I don't know that there's a right answer necessarily, so much as it really is dependent on your situation and kind of like there's never any harm in putting yourself out there, and particularly I think maybe the secret that I will disclose that maybe is not a secret is cover letters are really meaningful. Like I as a hiring manager will read every cover letter, and for someone, that's the first thing I read before I review someone's kind of CV or resume. I always want to get a sense of like, why are they applying? So, like, who is this person, and like what is their passion, and what do they see? Because sometimes people will say things in the cover letter that I would not have gleaned from their other materials. So I think that can be a good way to set the tone and to kind of explain who you are and kind of why this role is something that you think you're ready to rock. And I wouldn't let the qualifications on the website dissuade you. If you feel like you're falling short of, it specifies I need 5 years, I only have 3, so I'm going to wait 2 years. Like, definitely don't do that. I think people will put qualifications on there, but ultimately it's to set some expectations, but not necessarily to weed people out. And so don't let the job description kind of dissuade you from applying if you feel like for some reason it's not the perfect fit. I think the combination of a cover letter and if you get that first call of someone being able to articulate why you think that this is a role that you will be successful in, just kind of getting your foot in the door.
Yeah, what I would add to that is verbal cover letter. So networking, just a lot of times, especially with startups, roles don't exist, and then suddenly they get funding and they're trying to hire quickly, and they already know what you could bring to the table and what are the many different skills you have to offer and how you could bring value to their team or the company. It's really helpful. So I was, yes, right place, right time, but also getting uncomfortable. Like I talked to a lot of people. I did so many informational interviews, and I had never done one before I decided to transition to health tech. And, reached out to my business friends that they get trained a lot on how to have great informational interviews and network and all these things, and just learned people love sharing what they know and really understanding what value I could bring. So then I could just share that with people and talk about what they were doing and be curious. And that really worked out, where people were reaching out to me when roles came up, right? And just said, hey, I think this would be interesting for you. So that was really helpful. And then I could pass those along too, which is a nice way of kind of giving back to the community and building that network.
Thank you both so much.
I guess as a follow-up to Mercedes' point, what are some steps that people can take to effectively network if you just don't know anyone in the digital health or tech industry?
I feel like you've all taken at least one step because they're all here. So I mean, like having I think it's almost like just short of 900 people in this community. I would say, I don't know what the breakdown is, but I would say at least a third of them are actively working in this space. So I think I would say, like, I'll speak for myself. Like, people will sometimes message me, and I'm more than happy to exchange messages or talk to someone or hop on a call. I think it's just like I think to Mercedes' point, just getting comfortable with putting yourself out there, because it really will make a difference in a way that maybe in an academic environment, the returns on networking may not be as immediate. It really is. It can be the difference between someone thinking of you, flagging an opportunity, or getting through that first hurdle because someone that has kind of said, hey, I have this person, like, let me connect you with them. Like, it does make a big difference. So I think it's just knowing that everyone in this community has probably been there at some point of either trying to meet somebody or having an introduction made. So I think it's just kind of like a paying it forward. So I think just being here is a huge part of taking that first step towards building your network and your community of people that you can tap into, both when you're looking for opportunities, but also when you have opportunities to fill later in your career and you're looking to bring people on.
Yeah, exactly. And I think genuine networking, right? Being real. And I love when people reach out and they're like, hey, can we talk about this specifically, or this about your background, or what you're doing really made me interested, instead of just like a blank, hi, can we connect? Those, because we are busy and of course we want to be able to help, but when you can add that, I researched a little bit about you or your team, or this is what I'm thinking, it really makes a difference too. And I think it makes people more likely to want to, just pay it forward too. It is hard transitioning. There's no rule book. It's all new that we're all doing this. So I think we all understand that.
We had another couple more questions come in the chat. I'll read in order. Sounds like both of you work in tech full-time or almost full-time. Are there part-time opportunities? I have a group practice and I don't want to give that up.
So I know we currently, just given the way that we are kind of built, like, I think it's just kind of two ways to answer this. One is most of our roles are full-time roles, but we do have opportunities for subject matter kind of advisors or experts to consult, and that's kind of more on an hourly ad hoc basis. So it wouldn't be like a 15, 20 hours a week of work, but it's going to be more as needed. But I do know that there are part-time consultant roles, or kind of like the equivalent that exists. Just I personally, we don't have any on our team currently.
Yeah, same with us. Maybe my suggestion would be to apply anyways, or write that in the cover letter and say, like, this is why I still think I would be a great value add, and where you could kind of problem solve for the hiring manager. Okay, so I can only provide these hours, but this is what I could do, just to help them be a little creative. I think could be helpful too.
We had another question come in the chat. I heard you speak to differences in pace between clinical and industry work. Could you please elaborate on other possible cultural differences between clinical and industry work? Any surprising similarities?
So I think one thing, and I certainly learned this, maybe the hard way, is I think one big difference is I think when you are working on a project or you're doing research in academia, it tends to be like like there's a certain amount of like this is mine. Like I own this research. Like I am accountable and responsible for this, and it's almost like being the CEO of your research project. And one of the things that I had to learn and when I made my transition is how to keep an emotional distance between what you're doing because there's really and kind of how I relate to it. Because ultimately, I don't own the things that I create at a company in a way that I would own the outputs of my research as a PI on a grant or on a project. And I think it's a mindset that can be hard of just kind of how you relate to your work because it's important to be connected to it to have that passion and to do good work. But at the end of the day, being able to, as business needs maybe mean that you need to make different decisions or that there are deadlines that maybe would mean doing something a little bit different, being comfortable with that and being okay with it and knowing that is something that you are kind of part and parcel of working for a for-profit company versus kind of working in more of an academic research environment. So I think that was something that I personally learned and kind of had some experiences that helped me process that. And I've seen other people that have made the transition similarly kind of go through that process. And I guess to the last part of the question, I think I was mostly surprised at how much was the same in terms of the values that got me into this field in the first place and still being able to work within those the rigor that I bring to like the work that I do as a clinician and as a researcher, and the fact that I'm not compromising those, and nor have I been asked to compromise those. So I think there's a lot that's the same. Certainly, you're doing it faster, and the deadlines are much harder, and there is a lot more business kind of weight behind that. And I think, but there's a lot that feels very similar. And I think that was something that I didn't expect. Obviously, you work with different kinds of people, but yeah, there's a lot that actually ends up being pretty similar from a kind of core competency and then value standpoint.
Yeah, I agree. I do think I talk to lawyers more now than ever because it's the cutting edge and we're doing things that push the limit and still want to be ethical and very aware and thoughtful. And I think that's one of the differences. When I was in more of a traditional clinical setting or academic setting, it was more standard, and when I knew it was very clear what was within and with outside of our lines and our boundaries. And part of being cutting edge of health tech is that we have to be very thoughtful about how much we're pushing and why and what's the evidence and what are the legal guidance around that. And so that's been a different kind of learning between industry and academia and clinical. And then the other one is working with business and marketing. And those are, we were just talking in a meeting the other day about churn. So our families were churning. That means when they leave. That's a good thing, usually, unless they're leaving because they're not feeling, they don't like us. But oftentimes it's because they're feeling better. But from a business side, it can be a little bit negative. So how do you hold both? We want them to churn from a clinical perspective, but business-wise. And so how do you hold those and things like that, which is just really, I find it fun to navigate, but it takes some flexibility.
Someone had a question in the chat here. Do you have advice on interviewing for tech positions versus academic research positions?
Yeah, I kind of said it before, but I think being less passive in a way, like more solution. Okay, here's what I can bring to the table. Here's what I've researched, being humble, of course, but here's how my background, connect the dots for them. Don't assume that they know exactly what your value could be for the company, but you can share what you know, how you could help them, other experiences you've had that might be relevant or help you in that situation. Like Tim was saying, anytime you dealt with ambiguity or a lot of change, fast pace, even if it wasn't in health tech, highlight those things. I think could go a long way.
Yeah, and I'll say, show as much as you can, display passion and energy, because I think a lot of what particularly startups require is people that are high energy and can kind of meet that pace and work within that. And I think there are ways that you can kind of demonstrate your passion and kind of your ability to work in that kind of environment, even without, because I think what is on your resume will get you into the interview process. But I think how you kind of can demonstrate some of the intangibles or the soft skills that really are required, I think it really does make a difference. And I think there's also a set of questions that probably you don't need to worry about, hopefully not for academic institutions, particularly around funding and kind of viability of the company. I don't think many of our academic institutions are at risk of running out of money and not being able to pay people anymore. So you want to make sure you have some of those questions, particularly as you're interviewing with members of an executive team or kind of senior leadership that are going to be more able to answer those. So I think there's also some calibration of who are you talking to, what is their role, and understanding how you would interact with them. But some of the business leaning questions about runway and kind of the next funding, anticipated funding, will also help you get a sense of how mature the company is and how much you believe in the vision. One of the things I love when people ask is, what is the vision of the company? And people should be able to tell you across interviews the same picture, because it can be very telling if you ask 5 different people that work at the same place what the vision of the company is, and you get 5 very different answers.
And something else I would add is get a feel for how much they value clinical expertise and experience and like that intentionality versus driving value right away. There's always a balance, but really if you're going to be part of the clinical team or psychology therapy, something along those lines, that's also heard and that voice is given an important role.
I had a question come up in the chat that I was recently approached by a startup, and as a result of the conversation, I was asked to join the team and offered a founder's agreement. What should I look for in this agreement? I've never signed one before.
Well, first, congrats. That's very exciting. I don't know that I'm going to be of much help here because I have never been approached with an agreement like this, and I've had great ideas, but never an idea for founding a company. So I wish you the best of luck. I wish I could be more help here from my experience.
Yeah, I second that. Lawyers. That's all I have to just make sure you consult with lawyers and understand everything that's in there. But congratulations, that's really exciting.
I'm sure people have burning questions out there. This is a safe place. There's no like Mercedes said. There's no bad questions here. We're here to help.
I was wondering if Manatee or Click Therapeutics have internships, or what you think the internships like provide trainees with, like what kind of opportunities.
We do have internships at Click, and they've been variable. Sometimes they're on the summer, depending on what fits best for people's schedules. Variable in length really depends. Like I like to scope the length of an internship to really be around kind of like a project. Like how can we get someone the experience of? Because ultimately, the value is how do you begin to understand like what would it look like if you were to work in this capacity full time. So I think some of the experiences that are particularly invaluable are getting to be in meetings where there are people from very different disciplines that are kind of talking about things and understanding uniquely what is the clinical kind of perspective of this. So what is the way that we would contribute to this meeting? What are the roles that we would serve in there? I like to try to come up with ideas of projects and things that kind of will have you work with people in different functions, so you kind of get the experience of what is it like to work as part of a cross-functional team, which is where a lot of people spend most of their time. And I think there's something valuable about being able to kind of deliver something and have like a formal readout where you would provide that value back to the company and be able to kind of have that be because ultimately, whether it's a sprint, which is a smaller unit of measure, or something larger, there's something about the ability to kind of do the work and share it out and deliver that value and see how that's going to be used, after your time as an intern ends. That I think is just kind of a nice capstone of the experience. But it really is first and foremost just absorbing of what it is, what are the words, the way that people talk about things, what are the considerations that people have as they're weighing whether or not to do something, and just kind of being able to kind of develop that muscle or that mindset of, okay, now I'm looking for risks as opposed to kind of other kinds of ways of approaching work. So I think it's nothing else, just being there and being in meetings and hearing and listening and just being curious. I think there's really no substitute for that.
Yeah, at Manatee, we have a few internships. We're much smaller and early stage, so we have some in like product and marketing. But also, what part of being an early stage company means, if we were approached with someone that wanted to do a project or wanted, like, why not? I would have a conversation about, if you help me figure out what value add and what you would get and what we would get. It could be, there's more flexibility when it's early stage. But I wish I would have done an internship in health tech. It would have been nice. It would be a nice way to learn and understand what I like and what I don't like. Because it's also hard to know what, like going back to what we were talking about before, job descriptions, really hard to really understand what the job will actually be like and feel like.
I've had a couple of other questions come in the chat. First, is it common for researchers who go into tech to be able to keep doing research on the side with old collaborators, or continue to submit grants projects outside of the company?
I would say that the first part of that, so certainly, I still, at Click, some of our advisors are people that I've collaborated with in my past life as an academic, and continue to just benefit from their expertise. Now I get to pay them a little bit more money than I ever would have been in my previous role, which feels good. But those tend to be scoped to, now they are subject matter experts or informing some of the work we do. So there's a clear business value of kind of now what that relationship is, given the overall context. The second part of that, I think it really is it depends on, is this something that is aligned with or enabling something related to the business? In general, given the amount of time that would take, it would need to be something that's aligned with kind of the business, because that's, to be able to write, apply for, and then kind of see through a grant, that's something that would be a pretty big time sink. So it would really need to be something that we would discuss and need to figure out, is this something that's aligned with what we're trying to achieve, or is this something that is not going to be kind of an activity that really is because ultimately, if it takes you away from the work, it's going to be a hard thing to reconcile. So I think that would be probably case by case, but I would say unlikely.
I have another question here. This individual is a master's student in social work, and they are currently doing an internship with a mental health tech startup. They're completely new to social work and mental health tech as a whole. They're asking if there's any mental health tech industry publications, websites, or resources that they can review to stay in the know about what's going on in the mental health tech space.
Yeah, I think Rethink Behavioral Health, a newsletter, The Rock has a newsletter. Following people and companies on LinkedIn has been helpful. I'm blanking now, but Jessica DeMassa there's a YouTube channel where she interviews people. That's really helpful too. Tim, do you remember the name?
I don't, but I remember seeing that posted somewhere on one of the channels in Therapists in Tech. So I know it exists in the archives.
Okay, good.
Yeah, the other two I'll add, depending on your interest in because it's a pretty big space, kind of we'll call it digital mental health or health tech. So there's the two I like are Exits and Outcomes, which is I think a little bit more specific to digital therapeutics, but it's a nice overview of kind of what's going on there. And then Fierce Healthcare's focus on digital health. So rounding out kind of additional resources. But yeah, I would say that's how I Rock was a big one for me for getting, that's Rock Health for people that don't know. It was great for me for getting a lay of the land when I was first kind of entering this space.
Thank you, David. Yes, you just put it, W2. Yeah, thank you. What's the future of health? Thank you.
Someone brought up in a chat about salaries. For clinicians wanting to get into tech or in a process of doing so, what suggestions do you have in discussing and negotiating offers for junior and mid-level non-clinical roles like operations or product?
I like asking, what are you concerned about? Is it equity? Is it cash flow? Because I can also give you an idea of where their mind is. There's creative ways of also structuring salary depending on the stage, where you could do a step-up process depending on the next round of funding. You could do more equity. It really depends where you are too. Therapists in tech did have, it's hard to know the salary. It's really hard. We did create a survey, and that was helpful to try to see. Again, you see a wide range.
Yeah.
I don't know.
And Ash just posted that in the chat. So
there we go.
Yeah, I would say, and this is another one where it's not in any way uncouth to ask people that are in roles. I mean, there's a lot of, particularly if it's people that you are kind of talking to. I think if someone asked me, I would be willing to disclose or share what I made, because I think there is a certain sense of there's a lot for these kinds of roles. You're still not good benchmarks. Like the survey we put out is, I think, one of the better ones that I've seen, and really is setting the frame. And this is something I'm continually evaluating, like what is the right and competitive salary band for folks with these kind of backgrounds. So I would say, don't be afraid to ask people as you're talking to them in similar roles about what their compensation is. I think it's a great way to learn and have some additional data points.
Yeah, I think it's really important that we share that. I know it's taboo in U.S., but it's the only way, really. Otherwise, especially if you're a minority or it's important to be able to share and support each other.
I have another question. Was it difficult for anyone to make the transition from academia to industry with academic mentors or people who just always thought you were going to be on the academia route? I'm personally in a very research heavy, intensive clinical research program, so.
So is the question more about kind of how do you have the crucial conversation with an advisor about wanting to make an exit from the academic path?
Yeah.
I think every year that passes and the data for kind of the number of people from our programs that actually go on to tenure track jobs gets more and more bleak. I would hope that data starts to create some sort of feedback loop where people begin to realize that more and more folks are going to be exploring additional opportunities. And I think that plus the growth of this space and the viability of this for people with our training backgrounds, I think it creates a pretty compelling case to make of just from a pure data standpoint. I think it all kind of checks out, and I think it's that plus just to the points we've been making earlier. This is not I'm going to abandon all of the values and the knowledge that I've gained as a graduate student in the service of this role. You're applying it. It's just applying it in a different way. And I think there is a lot of value, and frankly, a lot of our advisors have never worked outside of these, so they only know one life. And I think there is a lot of value of kind of demystifying, if you will, what it means to kind of go off the beaten path, and the fact that You know, you're not selling your soul, you're just finding a different opportunity that's more aligned with kind of how you want to put your skills to good use.
Yeah, Claire, my advisor, we're still very close, and he's a true mentor, and I was so nervous. He's very social justice oriented and cares a lot about helping underserved communities, and here I am, I'm like, I'm going to health tech. And I was nervous about telling him and what that meant, and it was fine. He completely understood the values and also the financial reality and my own personality that was not a good fit for what I was doing before. And ultimately also, even if they don't fully understand it, because like Tim was saying, they probably have not been exposed to it too much, it is our career and our path, and we're making the choices that feel right to us and that meet our current needs.
Thank you.
Good luck.
Hi. Hi, I have a question. I'm an LMFT, but I've always been very passionate about the tech side of things and efficiency and organization, and how agency work is usually not any of those things. It's not organized, it's not efficient, and it's kind of hard to be in. So I left agency work to do private practice, but I've also started a class for associates who want to do that as well. I'm wondering what would be advice to associate therapists, so grad students, new therapists that are interested in kind of getting into this tech field from the get-go, instead of waiting until after getting licensed or after getting a Ph.D., who really want to make a difference on this side of mental health care.
Yeah, I think it depends. Some companies can take trainees, some are not set up for that, but there's also other non-clinical roles perhaps. So it could be translating or care coordinating or writing content or there's different things like that that could get their foot in the door but of course they need to get their hours. So it's always a tension between getting hours. We're exploring right now being able to hire trainees for that reason. I think it's really important that we help trainees from the get-go get in and support, we're still looking into it.
Thank you. That's all.
I see we have a couple minutes left. Does anyone have any final questions, comments?
If you do later think of something, feel free to Slack me. Any questions that come up or anything you didn't feel comfortable sharing with the whole team. I'm super open. I think the more we can become a tribe and help each other, the better.
Same. And if you want to recreate the magic of the Fireside Chat, you can even add us both to the same Slack, and we can respond together in the same thread.
Yeah, because I'm learning with some of these questions. It's really helpful for me too. I'm constantly learning.
I mean, the last thing I'll say is, like, it can feel overwhelming at times because so much of this is new, but it's also really exciting. Like the fact that you're all here and contemplating like what a different career, or if you've already made the transition and kind of are thinking about new adventures or opportunities. Like, it really is exciting. I would just say enjoy the ride. It really is. It's a lot of fun, and the work that a lot of these companies, new and old, are doing. It truly is a lot of fun.
Yeah.
And the journey to getting there is one to appreciate.
I agree. And something else that was really helpful for me was talking with friends outside of psychology and therapy. So friends in business or in finance, and look at their resumes, very different than our CVs. And how do they think about things? Or friends in marketing, and asking more detailed questions about what their day-to-day jobs are like and what acronyms they use. It just really helped me understand my work a little bit better in health tech in general.
All right. Well, I'd like to thank everyone again for coming tonight. I want to especially thank our speakers, Dr. Campellone and Dr. Oromendia. Thank you so much for your insight, and I learned a lot as well. So hopefully we'll be able to continue building this community. We'll be having our next Fireside Chat planned for January 13th, and we'll be posting more details in the coming weeks on our website and also on our Slack group. Thank you all for coming, and you have a great day.
And thank you to you, Terrence, for your for keeping us all organized here and doing the moderation.
Yeah, thank you, Terrence. And thank you everyone for coming too.
Yeah. Take care, everyone.
Happy to.
Bye.